I'm Marina. I come from the national portal of open data in Slovenia. I am going to present an overview of data in Slovenia, and I'll be quick because Maja is going to present the COVID Sledilnik. So most of the data is from the National Institute of Public Health, and because the data is in high demand, it is published on the official government website, SI, because there it can reach the most visibility. The data will eventually be transferred to the OPSI portal, just it's not yet. However, we already have published data from the National Contact Tracing app Ostani Zdrav, and so in general, the apps in Slovenia could be divided into different groups. One is for general population, and the second is for more advanced users. Most of them were created as crowdsourced projects or by data enthusiasts. For data analysis and visualization, we have the Alpaca project, Ustavimo Corona or Stop Corona, and COVID-19 Sledilnik. And the fourth one, we also have the presence of coronavirus in Slovenia and its measures. This is an interactive dashboard, and it was developed by a company, GDI, and it's actually available free of charge. It displays the statistical data for regions and municipalities, which Slovenia has 212. And it displays the number of infected, the dead, the cured, and tested. And the second group is for more advanced users, and it focuses on the trends and predictions and modeling of the data. The first one is the Coronavirus Watch, this one. And it offers live worldwide media view, advanced visualizations, and more. One of the interesting features, in my opinion, is a 5-dimensional visualization of the epidemic's development around the world, which is this one. And the second one is what we will do in August. It was developed by a team of mathematicians and data analysts, and it's based on the bootstrap method to analyze predictions and scenarios of the development of the pandemic. And the third one is the projection of spread of COVID-19. It uses the SEIR model, the dynamics of the fourth epidemic population: disease susceptible, disease exposed, infected, and cured. And this is this one. And the last one is the Corona Live Info. It was developed by a researcher at Institute of Josef Stefan and is showing the spreading of corona around the globe. It offers an easy and user-friendly overview of statistical data by individual countries or combined worldwide. If interested, the user can also go more in depth of the data. Here we have the visualizations. And this one is not, okay, this one is not playing. Okay, I will link all of the apps in the chat if I can, and that's all from my side. Maja can take it away and stay healthy.
Thanks, Marina. I would say let's keep some of the questions for after Maja has done her presentation. Maja, are you available to? Are you able to share the screen yourself?
Can you guys hear me? Okay.
Yes, absolutely.
Okay, that's great. Let me try to share my screen. There we go. Share. Okay, can you see my presentation?
Yes, we are able to see it.
Okay, that's great. Cool.
Go ahead.
Cool. So, hi, everyone. My name is Maja, and I'm a demographer. And I'm also one of the data managers for the Slovenian COVID data tracker that Marina already mentioned. We're called Sledilnik, which is Slovenian for tracker. We are a crowdsourced, volunteer-based project dedicated to compiling and publishing and visualizing data related to the epidemic in Slovenia. And our aim is to give the public and to the decision makers a comprehensive overview of the epidemic in the country and to allow them a better assessment of the situation. And we're also really good at what we do. Almost 1 million unique visitors to our site per month can attest to that, and that's in a country of 2 million. We are the main data portal for the country. What you see here is a quick scroll through the website, but the important part is hidden behind the charts and the maps. It's, of course, the databases behind all of them. It's the data that we receive on a daily basis, that we clean, that we check, that we structure, and that we make publicly available on our websites and through our API. So I want to tell you a short data story. To give it some context first, the background, the stripes on this chart represent the population structure of Slovenians. So pink is over 65, yellow is under 24, and the green part in the middle is approximately our working age population. Now, the first chapter in this story is COVID testing. We can see here that the younger cohorts are considerably underrepresented, and in fact, so are most of the oldest, except for the over 85s. And the active population, so that's the green bars in the middle, are getting tested more than we might expect. The second chapter, of course, are the test results. This data allows us to look at age-specific positivity rates. We can also see that it's the working age population where most of the infections are being confirmed. And also this age distribution can give us a bit of an idea what effect vaccinating over 65s might have on community transmission. The next chapter are, of course, hospitalizations. Here the age structure is quite different. We see over 65, so the pink represent the great majority of people in hospitals, which of course again means that we can expect vaccination of those age groups to bring significant relief to the hospitals. Next, of course, are the ICUs. And again, mainly pink, over 65s represent the great majority. You also see the age structure is quite different to the hospitalized population. One of the reasons is that over 85s are generally too frail to survive intensive care and are usually not admitted. And finally, of course, the age structure of deaths with COVID. And of course, as you'd expect, this population is the oldest of them all. Only about 5% are under the age of 65. And again, we can infer that vaccinating those age groups will have a massive effect on the expected death toll. Now, I tried to make this story super short, just to show you that a quick analysis with very simple and very accessible data using only age groups can give you a lot of insight into the epidemiological situation. We can learn about how testing is accessible to different age groups at different rates, which also affects how we can model confirmed cases and hospitalizations and deaths. It also lets us think about how vaccination rollout will affect these outcomes. There's only one problem with this story, and that is that I lied to you. You see, in fact, we don't actually have all of this data. This is the data that we have that is publicly available. So only the positive tests and the deaths. I didn't make the rest of it up, of course. I had to use my personal connections and asked really nicely. And I got, you could say, a one-off data dump from one of our national testing labs where I know the director, and one of our hospitals where I know the main administrator. So personal connections work. The thing is, the data is out there. It's being collected. So what I showed you is all real, but of course it's not representative, and it's not a regular data flow, which makes it quite useless to us. Except, of course, for this presentation to prove my point. So what is my point? I know there's no shortage of tragic stories in this pandemic, but this is another one. It's the tragedy of underutilized data, or wasted data, if you want. Because what I'm talking about is not some fantasy of like, oh, wouldn't it be lovely if this data existed? I'm talking about data that we know is out there, and there are people, mostly frontline workers, who are entering this data into their computers on a daily basis. But the data isn't really being used, or rather it's being massively underused. So it's a story about systemic waste of public data. But I would also maybe be a little bit optimistic and call it a story of low-hanging fruit. Because I think this data is often collected almost habitually without a strategy about what to do with it. But here is a strategy that we would recommend. Open it up and don't let it go to waste. What I'm talking about is completely anonymized data with no risk of disclosure. It's data that requires minimal processing. And it's data that, if it were made public, not just to us, to everyone, can really offer insights far beyond what the individual owners would be able to do with it, even if they had the will and the capacity. And of course, I can only sympathize with the lack of human resources that relevant institutions have, especially right now. But we're all obviously aware of the vital role that data plays in a pandemic, and the cost-benefit calculation here, I think it's simply a no-brainer. So thanks, that's it from me. And obviously very happy to take any questions.